Hello students, we will discuss very common simple condition. I will show how exactly it looks like. What this condition is, look at that. Anal canal, there is two tags are there here. Front it is like this, it's anal canal, posteriorly it is like that. Both anteriorly it is there, posteriorly it is there. So look at that here, anteriorly, posteriorly. What these are called as, it is sentinel pile. Sentinel means guard. It can be part of the fissure in nano. Fissure in nano has got, which is the longitudinal ulcer, proximal hypertrophic papilla is there, distally sentinel pile is there in a chronic fissure in nano, not acute. Or it may be just sentinel external pile. So this is sentinel means guard. Word meaning is guard. What are the features? It is projected perianal skin tag as guard, I already told, commonly seen in the chronic fissure in nano. It causes perianal hematoma, abscess formation, infection of the skin. It is excised with fissure in nano. If it is only external tag, you can excise it with the cautery. If it is the chronic fissure, you have to do a fissurectomy, and along with that, you have to add on to lateral sphincterotomy. So sentinel tag, so to the fissure in chronic fissure in nano, sentinel tag sometimes only it is as external pipe that should be excised. Otherwise, do a fissurectomy and a lateral sphincterotomy. So that is about sentinel plane, very commonly seen condition. So you should have idea. MCQ they may ask, exam they will ask, theory they may ask. So go through my clinical methods in surgery, how to examine rectal examination, and go through my SRB's manual of surgery for detailed explanation, operative surgery for perianal surgeries and other surgeries in detail, and tissue approximation for suturing technique, and my DigiNow lectures through JP Publishers in detail about all lectures, specialities, operative surgery, X-ray specimen, basics, instruments in detail will be there. Please you can subscribe for a year and so. So students, I hope you understood this sentinel file very well.